Hey friend, welcome to the channel. My name is Chiago and I'm a third year medical student. August 23rd was our first day back in school as we started our link block to transition into clerkship. I woke up at 6 a.m. to do some stretches, drink water, and poured myself a cup of coffee, and then I went to my studio to do my morning journaling before class started. Our first class started at 7:45 a.m. with our welcome back lecture, giving us a rundown of what we should expect for the week. It was pretty straightforward. Then I had a break from 8:30 a.m. to 1 p.m. where I ate breakfast, worked on my high performance coaching program, and came up with some YouTube video ideas. And by the way, I launched an online program that's focused on helping students become more productive, overcome procrastination, and get back 10 plus hours in their week. Check out the description for more info if you think you'd be a good fit for the program. At 1:30 p.m., I had to be present in class to practice our physical examinations. Once that was finished, we were done for the day and I went back home.
All right, today's the first day of school. Pardon the messy hair with the wind. Today, I decided to park a little bit further away from the hospital because I don't want to pay for parking or get a ticket. So I parked on the street and now I have the one wheel and I'm going to class today. I'm probably not going to be able to show it too much. We're doing some general exams on some dummies, but it's still kind of weird to show that stuff. But today marks the first day of third year of medical school. All right, I'm in the class. I had to hold my one wheel the entire time. It's pretty heavy. Not something I want to carry for a long time, but I'm in the room here. Got the mannequins. We are starting off with the male genitalia inspection, then going on to do the speculum examination, the female and the genital area, and then the breast examination. So that's gonna be 20 minutes each station, just kind of reviewing these things to get us brought up to speed for when we are actually in the clinic.
On Tuesday, it was still a calmer day as my first class was at 9:45 a.m. For this class, we practiced performing a breast examination to screen for any breast cancer. This time, it wasn't a mannequin, we had a standardized patient come in. And one of the best pieces of advice I can give for med students who are going to be practicing clinical exams is to watch geeky medic videos online on YouTube or on their website before showing up, because that's going to help you tremendously.
All right, so it got a little messy that previous clip because I had to open a gate and I had to use both my hands, but just finished doing a breast exam on a standardized patient. It was pretty quick. The doctor teaching it was really nice and the patient was really nice. So now I'm gonna go home. I have to go to a chiropractor at 12 p.m. After chiropractor, I have a telemedicine consultation around 1:30. But that's it for the day.
Once the exam was done, I one-wheeled back to my car and drove home because I had a chiropractor appointment at 12 p.m. Because chronic back pain at 25 years of age is a thing. At 2:30 p.m., I had to do a telemedicine consultation with a standardized patient. That also went well, and it's always good to get more practice in taking patient history. I find that I tend to rush my interviews, so if I could improve on one thing, it'd be using up my full time with the patient and ask lots of questions.
All right, it is 2:27 and I'm just preparing for my online consultation here. So it's just a practice run with a standardized patient where we get the case and we have to talk to, in this case, we talk to the parent with the child, whatever issue they show up with. And they just want to practice, the school wants us to practice taking their history, asking questions, motivational interviewing. And they want us to write a SOAP note, subjective, objective assessment, and a plan, and submit it for review. So it's just pass or fail. We just have to do it. But yeah, in 2 minutes, I'm going to be talking with a standardized patient, a father and a son, or a mother and a son, to see if I can help them out, figure out kind of like what's going on. Never know with these cases. They can be detailed. They can, it's all good. It's going to be fun. It's part of it. So I'm looking forward to it.
Now, the first 2 days were a nice way to ease into the school year, but Wednesday and Thursday were significantly longer. Before moving on, I just wanted to say you are fearfully and wonderfully made. Don't give up. You can handle the challenge that's in front of you. I just wanted to encourage you with that right now. For Wednesday, instead of going to school at RGN, we needed to go into the simulation center at the Civic Hospital. We were asked to arrive earlier to the hospital because we have to do COVID screening, and then because the entrance doors were closed, we needed to access the building through a sketchy tunnel underground. Me and a couple other classmates walked around for a few minutes trying to find out how to access this tunnel, and we finally decided to ask for some help and arrived at our class 15 minutes late. Good start, right? Our first class was scrubbing, gowning, and gloving. This was where they taught us the proper technique to scrub our hands before going into a surgery, putting on a gown without contaminating our hands or any sterilized field, and then putting on gloves. Since this is something I've done in the past in previous orthopedic surgeries and general surgeries, I felt quite comfortable doing this. Next, we went into an infection prevention and control class. This is something that is drilled into us every year because one of the best ways to prevent any type of outbreak, whether bacterial or viral, is just to wear the proper personal protective equipment. So it's important for us to know what PPE to use in a normal situation when there's a droplet precaution or an airborne precaution.
Alright, so today we have done first session with scrubbing. We got a whole bunch of our class down here. Nick's okay with being in the vlog. So we did scrubbing, putting on the gown, cleaning our hands, and then we did infectious disease control, just learning how to put on masks, clean our hands again, and now we're going to go into case integration unit. We don't know what that's going to be about. I think it's just taking care of a patient that's in shock, but so far it's so good. Pretty calm day. Busy. We've been here since 8 a.m. and we're going to be done at 12:30, and then we have one more, was another case integration, like a virtual later on the day.
All right, now our third class of the day is probably one of the favorites out of the entire week. Unfortunately, I wasn't able to record any of it because the circumstances just didn't allow it. So let me describe it. There was a group of 10 people in a room that looked like an operating room. However, in the middle of the room, there was a mannequin laying down and he was hooked up and we could see his heart rate, his oxygen, and everything else we needed to know about his vitals. Professor walks in, she tells us, hey, you guys are going to have to take the patient history, diagnose him, treat him, run some lab tests, and then I'll come back. So I raise my hand. I'm like, how are we going to take the history? We just talk to the mannequin? She's like, yeah, you just talk to the mannequin, he's going to respond. She walks out. I walk up to the mannequin with a group and I'm like, hey, what brings you in today? And we hear a professor's voice in the microphone. So she was talking for the mannequin. However, there was a part where the mannequin responded in short words and they kind of freaked us out. As we're taking the patient history, his oxygen level starts dropping, his heart rate increases, and everybody's looking at each other and we're like, maybe we should give him some oxygen. So we walk over to the cart, grab the oxygen mask, we put it on the mannequin, and the O2 sat starts to stabilize. So we're like, okay, well, that's pretty good. We continue taking the history, we do physical exams, listen to breath sounds, and we can actually hear wheezing and some crackles, which is insane because this is a mannequin. We can hear the heart rate and everything. So at this point, we can actually use our cell phone just like in real life to look at medications and how to treat the patient. I mean, as a team, we work together to prescribe antivirals, antimicrobials, Tylenol to treat the fever, and overall the mannequin starts to feel better. After half an hour, the tutor walks in and she tells us what we did right and what we did wrong, but it was very exhilarating. It was exciting. And I wish we had more exposure to simulation cases like this in the previous years. Once we were finished the simulation case, everybody went home, ate lunch, and then we had 4 hours of a tutorial lecture for the rest of the day. On Thursday, I woke up at 5:45 a.m., worked on coming up with YouTube video ideas, writing social media content. At 8 a.m., we began with a workshop on phlebotomy and IV insertion. This is something most doctors don't really do, but it is something that it is important to understand and practice. And there are a lot of little steps that we needed to practice more on, but overall, it wasn't too hard and we were getting the hang of it. Some situations where we do phlebotomy is to take blood samples or to give blood. In other situations where we would use an IV is to administer fluid to a patient, medication, or test their blood. Once that was done, we moved to an arterial blood gas workshop where we practiced taking blood specifically to measure the levels of oxygen and carbon dioxide in a patient's blood. The main difference here is that we use a syringe with heparin that kept the blood from clotting, and that we're taking blood from an artery and not a vein, whereas an IV and phlebotomy is done on a vein. The next workshop we had was at 10:45 a.m. and it was a cardiology review session. I didn't get any videos of that because there was a standardized patient. All right, so it's lunchtime. Nick and I are just eating, he's chilling, look at that. But we both agree that it feels very much that it's the calm before the storm. So we're enjoying the outdoors, enjoying the sun, the breeze, eating outside. And this week and possibly next week will be a little slower, but as soon as Clerkship really start, that's when things start picking up. But today's been fun. We've been doing the
phlebotomies, the IV catheters, we did a cardiology section, which I wasn't able to record, but it was just general cardiology clinical skills. Today we are going to start up again at 1:30 all the way till 5:30, and we're going to cover some more suturing skills, then how to place catheters, and then some more IV stuff. So it's a full day. Fortunately, tomorrow's a little easier. And then we got a weekend as a break, and then we start up for third year. So Nick and I just discovered a new motto: when you can take a nap, take it. We're gonna just chill for a couple of minutes before you go back.
After cardiology, we had an hour-and-a-half lunch break. If you're enjoying this video so far, don't forget to subscribe, hit that notification bell, and like this video. This lets me know that you are enjoying it, and feel free to comment what sorts of videos you would like to see in the future from me. Once lunchtime was over, we walked back to the simulation center, and our first workshop back was surgical skills, where we learned how to suture. This is a skill I learned back in 2016 when I shadowed a couple of doctors in Brazil, but it is a skill that is fun and good to practice to strengthen my technique. I started out a little bit rough, but towards the end I was able to tighten my square knots better and build up my speed. This was Nick's first time, and he was also able to improve during this workshop. I would say this is one of the favorites out of all the workshops after the simulation center. The next workshop we went to was one about catheter insertion, and because the mannequins were showing the private parts, I felt a little bit weird about recording it, but we got to practice inserting catheters in a male and female mannequin. Some of the reasons why a patient would need a Foley catheter is for acute urinary retention due to benign prostatic hypertrophy or blood clots, could be chronic obstruction that causes hydronephrosis, could be initiation of continuous bladder irrigation, and more. Lastly, we finished off the day with measuring blood pressure and practicing inserting some more IVs.
My blood pressure here. First, he's pumping the lamp cuff until my radial pulse disappears. As soon as it disappears, probably around 120 as well, then he's going to deflate it. After that, he's going to pump it up 20 millimeters of mercury past that, and slowly listen to it through the stethoscope. And as soon as he can hear the first sound, that's a systolic number, goes on top, and then as soon as the sound disappears, that's the bottom number of the blood pressure.
Friday is our last day of our link block, and after this, we begin our academic week in Clerkship.
8 a.m. to 8:45, and now we have about 15 minutes or so, half an hour, to transition to going to school and doing some clinical exams, all about neurology. So we have a long time, I don't know, like 2 hours, about 9 to 12 of just neurology, where we're gonna practice some stuff. So I have to head over, park close to the school, and then one-wheel it to the school and get there on time. So let's go. Also, I have no clue if we have a standardized patient. If we do, I won't be able to record anything, so I'll just describe kind of like what we do. You've seen it done before on vlogs, or maybe I can describe it later so you have an idea of exactly what we covered.
The day started off with a lecture at 8 a.m. about how to take a neurological history. Then from 9:15 a.m. to 12:15 p.m. we went into school to practice taking our neurological history and physical exams in small groups on a standardized patient. It's moments like these that I feel like I know so little in the grand scheme of things, and I feel so overwhelmed. But when it was my turn to take a patient's history, I did great, and everyone in the group did great as well. My advice for those of you watching is to remind yourself that problems aren't always as difficult as you think, and you know more than you believe. Once we finished our practical session, I went home and relaxed. We then had a reaffirmation ceremony online at 3 p.m. with the entire class, and the reason why we have a reaffirmation ceremony is so that the entire class can recite the Hippocratic Oath that we initially took at the beginning of medical school to remind us of our purpose in going into the medical field. After the ceremony, we concluded our transition to clerkship block, and then Jess and I went to a worship night with our friends from a local church.